As you can see on the screen, I have kept the slide concise with key bullet points for your quick reference. However, I will be explaining each point in a more detailed and clinical context during my talk. Good day, everyone. Today I will be demonstrating Spurling's test, which is also widely known in clinical practice as the cervical compression test or the foraminal compression test. In physiotherapy, we primarily use this orthopedic manual examination to assess for cervical radiculopathy. The core objective is to identify whether the patient's symptoms are originating from a compressed or irritated nerve root in the cervical. Before we perform the test, it is important to understand the underlying mechanics. Spurling's test is a provocative maneuver. By side-bending the neck and applying axial pressure, we are physically narrowing the intervertebral foramen. If the nerve root is already compromised, perhaps due to a disc herniation or osteophytes, this compression will trigger the patient's symptoms. We perform this when a patient presents with a radicular pattern, like radiating pain, sharp electric-like pain, paresthesia, tingling, or dermatomal deficits, numbness/weakness. To ensure patient safety, we do not jump straight to compression. First, we start with the neutral position. Ensure the patient is seated comfortably with a straight back. Next is lateral flexion. Ask the patient to side bend their head toward the affected side. Safety note: if the patient feels shooting pain during the side bend alone, you must stop there. Do not apply extra pressure. Finally, axial compression. If side bending alone does not reduce symptoms, place your hands on the crown of the head and apply a steady, gentle downward force. Positive results. How do we determine a positive result? The test is positive only if the patient reports a reproduction of their familiar radiating pain down the arm. If they only feel local neck pain, the test is negative for radiculopathy. To conclude, Spurling's test has high specificity, up to 95%, making it a very strong indicator of nerve root compression. However, due to low sensitivity, a negative result doesn't completely rule out a disc issue, and we may need tests like the cervical distraction test to confirm.